We looked at data around women's health and well-being issues, and pretty much everything, whether it was menstruation, fertility, mental health, financial stability, whatever it was. And then we looked at data that came out of like Harvard Business School and some of these other things about women having to provide twice as much information as their male counterparts to get buy-in. Think that's stressful? Of course it is. But the big question was all these bubbles of research. What is the secondary things that keep coming up underneath that's getting mentioned under here that the research is not really focused on, but we are seeing over and over and over again? And no surprise, I'm sure to many of us, is this caregiving issue. And the caregiving issue is for children, for aging adults, and yourself. 3 pieces. That is directly connected to financial stability and financial well-being. The more you understand the potential pitfalls and where the stressors might be in your own family dynamics or what, and however you define family, right? Like anything in life, this preparing for makes the eventuality of the unexpected, as I call it, because it really does happen, so much easier for people. And so this is where, again, you go back to when you can speak to somebody who can act as that chief of staff, act as that coach for you, and say, okay, let's really talk about your personal situation. You're going to become a caregiver to mom or dad or your older husband or whoever it is, right? Whatever that situation is. Let's do some pre-planning. There's all the practical stuff, the medical, the legal, the financial, the personal considerations, the family dynamics. And I really appreciate you brought this up. It can be one of the biggest stressors around this. The more a lot of this stuff is worked out beforehand, the easier it goes with all of these things. I'm going to start with the data piece.
Okay.
So, and this is specifically, I mean, this is a caregiving number-ish. So if you leave the marketplace for a caregiving issue, typically, you will end up on average leaving $400,000 to $800,000 on the table. This is you. This is money you can invest. This is money that would have been back for Social Security. This is potential raises that you would have gotten. It is a huge number. And that's an average number. So it really depends on where you are. But there is very little discussion about caregiving for aging adults. And, a couple of the, and I'm like you, I'm a stat girl. So I always talk about, what are the real numbers? I think it's interesting for business owners or business leaders to think about their employee who suddenly has to make decisions for mom, dad, husband, a loved one, friend, whatever it is. On average, they're going to spend about 24 hours every week making caregiving management decisions. This is not direct aid. This is calling about the doctor's appointments and dealing with Medicare or Medicaid and, the lawyers and how our financial things getting paid for and is the house getting cleaned and, oh my gosh, we've got to get a handicapped bathroom in and this isn't working and we don't know what to do. Family infighting. All of this tends to happen during regular business hours, so it has a clear impact on productivity, which is always a little hard, right, to quantify. We know